Hi, I'm Amar Deshpande from the University of Miami Crohn's and Colitis Center, and I'm happy to talk to you today about some frequently asked questions. One of the comments we often get from patients and providers is whether or not to use a thiopurine along with a biologic. I think there's a couple of important things to think about when we answer that question. First, keep in mind that the question needs to be contextualized. Do you mean starting a thiopurine with a biologic at the outset in patients that are naive to those, or adding on a thiopurine to a biologic? So for the purpose of this question, what we normally get asked is whether someone should be on a thiopurine along with a biologic while starting. And of course, many people point to pivotal trials, for example, Sonic from over a decade ago, that show that a combination of the two is better than either one alone. Keep in mind that that trial and many others looked at folks who were naive to both before starting, so people who were naive to biologics and immunomodulators, and show that the combination can in fact be better than either one alone. But another important caveat is how they designed the trials back then compared to how we routinely use therapeutic drug monitoring in practice now. So for example, the azathioprine arm for some of these trials that decided on whether dual therapy was better than monotherapy looked at folks irrespective of their TPMT level, where we now know that if your TPMT, for example, is intermediate, you might have a better azathioprine response than someone who has a high TPMT. Similarly, we now know much more than we did 10 years ago how to optimize biologics based on their trough levels and their presence or absence of antibodies, what we call therapeutic drug monitoring. So when we know that dual therapy was better than monotherapy in some of those original trials, we now know that when you look back at some of those biologics, if they had high trough levels, then it really was perhaps not as important that they were on a thiopurine because, again, the thiopurines largely worked by the reduction of immunogenicity, maybe some with synergy, but largely for the reduction of immunogenicity. Another important point is the biologics that we historically had were just the anti-TNFs, and now we have several other biologics, and so, for example, things like ustekinumab and vedolizumab are commonly used in practice now. And we know, for example, with those two non-anti-TNF biologics, that they tend to be a little less immunogenic, and it appears to be in several studies that there is less need for that additional thiopurine to add on to really make a substantive benefit. And so, again, think about what biologic you're starting when you're talking about whether thiopurines are worth starting along with a biologic. Finally, of course, you have to look at safety, and these are all very safe drugs overall, but when you combine drugs, there is that concern for safety. Of course, the largest safety signal generally tends to be with steroids, but even when you add two immunosuppressive therapies, it's always a consideration. So particularly for azathioprine, for example, we know that young men, particularly young teenagers, have a risk of a very rare disease called hepatosplenic T-cell lymphoma. And older men, particularly those in their 60s and 70s, might be at a higher risk of more traditional lymphomas. So those are people in whom it might not be worth it to add the thiopurine along to the biologic. Similarly, if someone has a history of a lot of non-melanoma skin cancers, that might be another reason to think twice. And though we're talking mostly about thiopurines, the same thing holds true for methotrexate as well. So someone at risk for some of the bone marrow or liver or lung toxicities of methotrexate, or a young woman who's looking to have a child pretty soon, those might be people in whom, even though perhaps an immunomodulator might confer some benefit along with a biologic, it might not in that particular patient population be worth it. The final thing to consider when talking about whether thiopurines are a benefit along with biologics is to consider whether this is the patient's first biologic or not. So certainly with the initial biologic, that's your best bang for your buck, and you want to try to reduce immunogenicity. But if a patient has a history of having issues with biologics, particularly developing antibodies to biologics, then all the more important to add a medication that can reduce immunogenicity and reduce the risk of antibody formation. So overall, in our current model, there certainly are reasons to combine biologics and thiopurines, but some of those strong reasons might be mitigated with current use of therapeutic drug monitoring. Always consider the side effects of both drugs, and consider the patient's personal prior history and whether or not they've had immunogenic reactions to drugs and whether they're more at risk for developing antibodies to biologics that might make combination therapy a better option. Thank you.